What's up? How are you, everyone? Looking to discuss over a new topic, that is delirium. What is delirium? Delirium means acute confusion of state. In delirium, we actually see what the cath level. What does it mean? In cath, there is consciousness is down, attention is down, thinking is down, and there may be hallucination. There may be hallucinations. And this is the thing you have to look in delirium. What are the causes of delirium? Predisposing risk factor is all the things like dementia, Parkinson's, prior stroke, advanced age, and sensory impairment. These are the five predisposing risk factors in delirium. Again, Parkinson's, prior stroke, advanced age, dementia, sensory impairment. What are other predisposing factors? There may be drugs like narcotics, like sedative, like antihistamine, like muscle relaxants, like if you do polypharmacy. If there is any infection like pneumonia, like UTI, like meningitis, if there is any metabolic problem like volume depletion and vitamin D deficiency and hyperglycemia. If there are any electrolyte disturbance like hyponatremia and hypercalcemia. If there is any systemic illness like congestive heart failure, hepatic failure, and malignancy. And finally, the CNS condition like seizure, stroke, head injury, and subdural hematoma. So, these are the causes of delirium. Again, in simplified manner, Parkinson, prior stroke, advancing stage, dementia, and sensory impairment. And the drugs like narcotics, like sedatives, like antihistamine, like muscle relaxant, like muscle. We actually use muscle relaxant like baclofen, like tolperisine, like epericin. There are any infection like pneumonia, UTI, meningitis, any sort of electrolyte imbalance, hyponatremia, and hypercalcemia. There are maybe metabolic derangement, volume depletion, vitamin B12 deficiency, systemic illness like congestive heart failure, hepatic failure, and malignancy, and CNS conditions like seizure, stroke, head injury, and subdural hematoma. What are the complications happens in delirium? Short term, long term, permanent. Short term, long term, permanent. In short term, there may be disorientation, falls, there may be immobility, pressure ulcer, prior intake, dehydration, aspiration, pneumonia, and prolonged hospitalization. These are short-term effect, short-term complication of delirium. Long-term, there may be persistent delirium, there may be nursing home placement. And permanent is cognitive decline or dementia, death, 20% mortality at 6 months. That's all about delirium. Hope you enjoy.